Welcome. My name is Tracy Stefik, and I'm the Senior Director for Safe Communities at Safe Project. I'm joined today by my colleague, Randy Abbott, who's our Manager of Volunteer Programs, and we're going to be sharing a little bit with you today about the intersection between substance use disorder and stigma, as well as some data and some tools we can all use, not only to combat stigma, but also change the narrative in our communities. So a little bit about Safe Project here. We're a national 501c3 nonprofit organization who's committed to overcoming the addiction epidemic. We were founded in November 2017 by Admiral James and Mary Winnefeld following the loss of their 19-year-old son, Jonathan, to an accidental opioid overdose. Hoping to save more families from the pain, the Winnefelds immediately channeled their grief into action and started Safe Project. And so today we're a team of multidisciplinary experts who use a collaborative, nonpartisan approach working towards achieving safe campuses, safe communities, and safe veterans. And we're actually in the works adding our fourth initiative called Safe Workplaces, focusing on businesses and corporations.
So, as Tracy mentioned, our founders, Admiral Sandy Winnefeld and his wife, Mary, you can imagine as an admiral that things are very organized in a very good way, but there is a strategic effort that has been put forth in a strategy to make a concerted effort to bring an end to stigma and to within our focus areas of safe campuses, safe communities, and safe veterans, and now safe workplaces, to make sure that we're bringing all stakeholders to the table. You can see our 6 lines of operation, which come from that philosophy of making sure that all stakeholders are a part of the effort within each of those focus areas. And you can see the 6 lines of operation here.
So let's talk a little bit about what addiction is and why it occurs. And so addiction itself is a medical illness, a brain disease, but you'll see on the slide there are 3 complex primary factors that can elevate your risk for substance use disorder. And they are biological factors, psychological factors, and social factors. So let's start off with the biological element. The National Institute on Drug Abuse defines addiction as a chronic relapsing disorder characterized by compulsive drug seeking with continued use even despite the harmful consequences and long-lasting changes. And so it's considered both a complex brain disorder and a mental illness. And researchers have even concluded that addictions can change the physical structure of your brain, primarily the prefrontal cortex, which overrides willpower and judgment over time. And so besides the way that addiction fundamentally changes the structure of our brain, there's biological factors as to why substance use disorder occurs. So these are things that are like our genetics, our DNA, hormones, our neurochemicals. They all play a role into whether we are more or less susceptible to substance use disorder. And so a good example of that is how if we have a parent that has substance use disorder, that elevates our risk in turn. But we know as humans, there isn't just one thing that makes up who we are. We are made up of many complex factors. And so there is a psychological component, and this is things like our thoughts or our behaviors and our actions, but there's also a social component. And so from a historical perspective, this might be things that happen to us over the course of our life. So if we had childhood trauma or how adverse childhood experiences impact us and play a role in our overall health and development. But also the way that our current environment impacts us as well. And so a good example of that is right now with COVID-19 and the pandemic, how we're all sort of facing increased stress and isolation. So really what's difficult about this disease is that it's not tangible. There's not any one of these factors is the same for any one of us. And we don't yet have the technology to measure how any of these factors might impact us like we do for other diseases.
So what do we do? How do we figure all of this out and what the causes are? As Tracy just outlined, there are a lot of factors that play into substance use disorder. One of those is mental health. and you've probably heard the term co-occurring disorders. We know, and the linkage is still not 100% clear, but we know that people with a mental health disorder are more likely to also have a substance use disorder in a lot of cases. So what are the statistics? One point that I always like to point out, because when I heard it the first time, it really, really stuck with me, is that this issue is a pediatric issue. That's the issue of substance use disorders. So what does that mean? That really hit me when the person said that in the meeting I was in. I thought, a pediatric issue, how's this a pediatric issue? Well, there's a survey that was done, and 90% of the people who took the survey, and these were people who identified as having a substance use disorder, 90% said they started experimenting with drugs or alcohol in high school. Over 60% started in middle school. So as we start to look at the statistics and we start to develop strategies from those, we know that we have to start prevention younger. Also, the National Survey on Drug Use and Health does a survey every year that kind of measures where we are. Pre-COVID-19, we had seen a significant decrease in opioid use disorder. And despite those gains, overdose deaths had increased, underscoring the risk of potent illicit synthetic opioids. Heroin use among 18 to 25-year-olds had decreased significantly. And then past year marijuana use disorder and past year LSD use significantly increased in adolescents. So we see one thing go down, we see another thing go up. Unfortunately, during COVID-19, we have seen an increase in almost all areas. People have lost access to treatment. Some programs and treatment programs have had to go virtual or quit meeting altogether. So people have lost a lot of those support mechanisms that are out there, making it that much more evident of what we need to do and how we need to move forward through this time.
Thanks, Randy. And I think that this concerning rise that we expect for 2020 is exactly why it's so important that we have the conversation around stigma right now, because we not only need to combat stigma, but we need to work on changing the narrative, focusing on our strengths, promoting acceptance, and shifting as a society toward valuing health and well-being and celebrating recovery. So what does stigma look like in our communities? Really, it's stereotypes and prejudice that result from misconceptions about mental health and substance use disorder. So really, it's twofold. One, there's external or public stigma. These are reactions from the general public, which might also be systemic. But two, there's internal self-stigma, and this is prejudice in which we turn on ourselves. So really what it looks like in our day-to-day can be shaming, isolation, embarrassment, withholding help, avoidance, coercive treatment, segregated institutions, and even discrimination. So it really just comes from the long-lasting inaccurate beliefs, but also creates less willingness for people to seek treatment. And previous studies have even shown that the public has withheld help from some minority groups for a corresponding stigma, and research suggests that being exposed to stigmatizing language over a period of time can affect clinical judgments and quality of care. So people with substance use disorder really are also just generally falsely considered to be more responsible for their condition by the general public, and that has an influence on attitudes and behaviors as well. There's a lot of stereotypes that exist in which depict people with substance use disorder as being more dangerous or unpredictable. And people with substance use disorder often internalize this stigma, feeling shame, and will refuse to seek treatment as a result.
So how does our language play into stigma, and what can we do to change that language and thereby starting to change the stigma that goes along with substance use disorder so often? Well, if we start thinking of using person-centered language, person-first language, and looking at the person first rather than the disorder first. So instead of saying addict or alcoholic, say a person with substance or alcohol use disorder, a former reformed addict or alcoholic, a person in recovery or long-term recovery, drug abuse, use drug misuse or harmful use. One that you still hear a lot, it's dirty or dirty drug screen. You know, people that are using drugs are not dirty. And that just really further stigmatizes the disease. So person-centered language might be actively using or testing positive for substance use. And there are many, many others. There is online, there's the Addictionary, which you can Google and find, and it gives you many, many examples of languages that we can change to help end stigma.
So something that we're doing that's really cool at Safe Project is the hashtag No Shame Pledge. And it's a way that we're raising awareness to fight stigma. We believe at Safe Project there is no shame in getting help or talking about mental health and addiction. So I'm encouraging all of you to log on to our site and sign our pledge and help us combat the negative perception that is out there and support others in talking about their own disorders. By signing the pledge, you're helping us to create a nationwide movement. And because we're currently in production to create a map that tracks these pledges and commitments from around the country, it helps us to signal that there is solidarity and create a sense of community, support from all around, especially when we know it's a real time of disconnection and isolation. So number one, I'm challenging you all to be the first in your community to light up North Carolina on the map. And also encouraging you to continue to check on our social media platforms because we have some really neat prizes and challenges lined up in connection to the pledge coming out. But also, the hashtag No Shame Pledge is something that's a great community organizing tool that can be used to drum up political will and raise awareness in your own community about how you're combating stigma. And something that can be used as a catalyst to drive social impact and help change behaviors in the community at scale. So for this purpose, we've actually developed a social media toolkit to help communities get the word out and replicate the campaign locally. The toolkit has a downloadable flyer, a news brief about the campaign, graphics, and even sample social media posts that are all prepackaged, out of the box, and ready for your community to use. And so if you do use these materials for a local campaign, what I would say is just make sure you tag us at Safe Project US on social media. And also we'd love to see any of news articles that are highlighting your work in action. So we're really excited to see what you do with it.
So what are some other resources? Probably the number one thing we hear from families that are dealing with a family member with a substance use disorder is where to start. Where do I begin? How do I find treatment? How do I find treatment that's right? So we created the Safe Project Safe Locator, and you can go to the Safe Locator at the link on the slide, answer a few questions about your particular situation, and that will populate a list of potential treatment centers that meet that criteria. And I say potential treatment centers because we do encourage you to always vet fully the treatment centers that are in that list, and to make sure that they do indeed fit your particular situation and your needs. We're also in the process of developing the National Family Support Locator, which will be the first of its kind, and it's exactly what it sounds like. It's going to be a list of things that families can turn to and places that families can turn to find resources. We need your help with that. Sorry, dogs, I love them. So we need your help with that. If you could go to the link here and let us know what's going on in your community. What are the resources that are there, and encourage those resources to fill out the survey. That would be great. And then there's our community playbook. So the community playbook is exactly maybe what it sounds like. Maybe it doesn't. It's a playbook or a roadmap or a guide, if you will, to get a community coalition up and running, make sure that they bring the right stakeholders to the table and know how to organize and how to get going to make the most impact.
So, wrapping it up today, Randy and I both want to extend our sincere thanks for having us. If you have any questions, our contact information is available on the slide. We're here at any time. Thanks again.
Thank you.